I appreciate the optimism. So I apologize for asking what may be a pessimistic question, but it's coming in from our audience. This is a question submitted earlier from Gregory Landman of Georgia, who asked, and we're not just talking about the Delta and Omicron waves, but have 2 years of the pandemic broken our hospitals? I have seen a negative impact on rural hospitals that lack the resources of their urban, suburban-based peers. Dr. Zink, based on what you were just saying, can you take this one?
Yeah, no, Gregory, I hear you. I think that our rural hospitals have always been challenged. I think that the gaps and inequities within our current healthcare system have grown into chasms during this pandemic. And we see that in the inequities that we see in both racial outcomes, but also in what we see with rural versus urban divide. We see a lot of people leaving the healthcare system as a whole, and we see many hospitals really being devastated by what has been now going on 3 years of just an incredibly challenging time. And so I think the more that we can approach this with understanding, with kindness, the more that we can really get back to that patient physician or patient healthcare provider relationship, the more that we can support healthcare workers, the mental health of healthcare workers. It has been strained prior to this pandemic. It has only been magnified during this pandemic. And I think that we really need to structurally look at the way that we address inequities, particularly rural and urban divide in our healthcare delivery system. We have a very urban-centric delivery care system, as well as the way that we train healthcare providers. We're working on that. GME funding is now making it easier for people to train in rural areas, but we are all in this together. And what happens in a rural area does impact an urban area and vice versa. So I really appreciate that question. And this is where I think we really need to focus how we rebuild our healthcare infrastructure and our public health infrastructure moving forward.
Dr. Zink, my colleague Akila Johnson recently wrote a detailed story about the challenge of serving Alaska Natives who often live in tough to reach communities. They struggled with poor health outcomes before the pandemic, as I think you alluded to. Are you using this moment in any tangible way to try and improve the safety net for them? Is there an intervention you've overseen to make sure that that community is better equipped moving forward?
Yeah, honestly, I cannot think of a better partner during this pandemic than our tribes. We have 226 independent sovereign tribes in the state of Alaska, and their leadership, their partnership, their history, the fact that they were really decimated by the 1918 pandemic. And every pandemic and epidemic that has come through this world that we have documented has unfortunately disproportionately impacted Alaska Native people. That oral history played a huge role in the way that we were able to respond to and continue to respond to this pandemic on a regular basis. So, for example, early on, testing was coming in via different resources. We were manufacturing our own testing, and we found that if we were able to get communities the resources they needed, they were able to really mitigate and control the pandemic in new and unique ways. They were able to identify cases early. They were able to do housing and quarantine. If you look at our vaccine rates, they're actually highest amongst our communities that are have the highest rate of Alaska Native people. Our Eastern Aleutian tribes is greater than 90% right now vaccinated in that region. And we built every aspect of our response in partnership with our tribes. So, for example, our vaccine task force at every single level had a tribal partner as well as a state partner so that we could really see what the other one was doing and be able to move forward. And a lot of our success, we led the nation for about a month, and then most people vaccinated per capita was because of the incredible ingenuity of our tribal health partners who are getting vaccine out by dog sled to elders in their house, or man baskets between fishing vessels, or snow machines on airplanes that were moving back and forth. They know their community. They know how to share information. They know what is a priority. I love being on meetings with whaling captains where they're the ones who are leading the meeting, and I am just there to share the information about COVID, and they can make it apply to their community. So I really think we all need to lean into those trusted leaders in our community. What that looks like in New Jersey versus Upiyavik are very different. But regardless, be it a church leader or a whaling captain, these are our leaders in our communities that we need to continue to partner with to make sure that we're all thinking about the health and well-being of our communities.